can keep it. And every American is going to see their insurance go down by $2,400 a year. Reality? Americans have seen our health insurance go up by an average of over $2,400 a year. Many employees of small businesses are facing losing their health insurance because their business can't keep it. Obamacare is bad for job creation. I've had a long list of people tell me they're afraid to hire because they're afraid of what the rules are going to be. And Obamacare is bad for seniors. In its place, they cut $714 billion out of Medicare and put in its place a group of unelected bureaucrats. And we'll talk about that in the next segment.
Mr. Morris, 90 seconds.
It's not my place or role to apologize for the administration or frankly for the prior Congress for doing a bad job of explaining and selling this law. All I can do is shoot straight with the people of North Mississippi of how I read the law, what I think the effects would be, and how I would vote in Congress. And I can tell you, the easy political thing for me to do would be just come out against it and throw it all under the bus because that seems to be popular sentiment. But I can't do that in good conscience because I look at this law and I see a law that despite all its faults and all its criticism is the only real effort at health care reform in my lifetime. It's not perfect, but it does for the first time prevent a child born with juvenile diabetes or some other condition from being denied health coverage all of their life. It for the first time prevents all of the women in this room and across the country from being charged more for health care just for being a woman. It prevents devastation of families from health care costs because they hit an annual limit or a lifetime maximum just because they got sick. And I'm not willing to go back to doing nothing. But it doesn't surprise me that this current Congress would want to do nothing on health care. They haven't done really anything on anything else.
Congress, you have 60 seconds.
Obamacare cut $714 billion out of Medicare. And in its place, put in a group of 15 unelected bureaucrats that are going to make decisions for people like my mom and dad who are on Medicare. What would I replace it with? We ought to have a health care system that's driven by patients making decisions with their doctors, their other health care providers. We don't need health care decisions made by government bureaucrats. Neither do we need health care decisions made by insurance company accountants. If we put patients in charge, you'll see our health care system be reformed.
Mr. Morris, 60 seconds.
As a candidate, I know everyone, at least if you're not for me or if you're undecided, takes what a candidate says with a grain of salt. So don't listen to me. Listen to what AARP said. And they said the $714 billion that was used in cost savings under the Health Care Act extended the life of Medicare for 8 years. They said the Health Care Act saves seniors about $500 a year in out-of-pocket costs because they get free screenings now. They also said that the Ryan budget that our congressman voted for twice and that this Congress has passed twice, that the $700 billion that they cut out of Medicare was the wrong approach. That's why I was endorsed by the Alliance for Retired Americans. That's why AARP has said this is worth keeping and that the Ryan plan is worth ditching.